Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is fear of gaining weight? Obesophobia. Fear of gaining weight is also called obesophobia, or pokrashophobia. It's considered to be a specific phobia, which is a type of anxiety disorder. Having obesophobia means a person has an abnormal, irrational fear of gaining weight or becoming obese. /r/n/r/n If left untreated, obesophobia can negatively impact personal relationships and manifest into an eating disorder. /r/n/r/n This article will explain the symptoms and causes of obesophobia and discuss the different treatment options available. /r/n/r/n Peter Daisley, Getty Images /r/n/r/n When a person has an extreme fear of gaining weight or becoming overweight, it's called obesophobia. It's most common among women in their teens, but men and women of all ages can experience obesophobia. /r/n/r/n A person with obesophobia often experiences severe anxiety around weight-related discussions, weight gain, and the scale. The fear of gaining weight may become so intense that a person begins to dislike people who are overweight. /r/n/r/n An individual with obesophobia will often avoid or dread talking about weight gain or have panic attacks if they gain weight. They may choose to bring their own meals or avoid social situations altogether where high-calorie foods outside of their strict diet are being served. /r/n/r/n Someone with an intense fear of gaining weight may also, /r/n/r/n A person with obesophobia, similar to other phobias, may experience the following symptoms when they experience weight gain or the topic is approached. /r/n/r/n Obesophobia describes the fear itself, not the behaviors associated with the fear. While someone with obesophobia is afraid of gaining weight, someone with an eating disorder takes extreme steps to avoid gaining weight, such as self-starvation and purging. /r/n/r/n Although obesophobia is considered a specific phobia rather than an eating disorder, obesophobia often occurs alongside an eating disorder. /r/n/r/n Obesophobia is one of the main symptoms of many eating disorders, including bulimia and anorexia nervosa. Research shows that most people with anorexia nervosa have a negative body image and irrational fear of gaining weight despite being underweight. /r/n/r/n Obesophobia isn't a diagnosis in itself. Rather, it follows the same diagnostic criteria as other specific phobias. /r/n/r/n Diagnosing obesophobia involves a visit with a mental health practitioner who will ask you to fill out a questionnaire. They'll analyze your symptoms against the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. /r/n/r/n The guide uses the following diagnostic criteria to diagnose specific phobias. /r/n/r/n Like many mental health conditions, the exact cause of obesophobia remains unknown. Many believe it's linked to social anxiety and low self-confidence. /r/n/r/n However, a specific phobia can be caused by various factors, including /r/n/r/n A mental health care provider commonly treats obesophobia. Your treatment plan will depend on the severity of your fear of gaining weight and if an underlying eating disorder is already present. /r/n/r/n The goal of treatment is to reduce negative perceptions associated with weight gain and decrease your risk of developing an eating disorder. /r/n/r/n Treatments for specific phobia include /r/n/r/n Cognitive behavioral therapy is a type of talk therapy where a licensed professional helps you sort through your negative emotions surrounding weight gain over multiple sessions. They'll help you recognize unhealthy, irrational thought patterns surrounding weight gain and teach you ways to cope. /r/n/r/n Exposure therapy involves a slow, gradual exposure to higher calorie foods in a safe, controlled environment. /r/n/r/n anti-anxiety medications, antidepressants, and beta blockers are sometimes prescribed to reduce anxiety associated with obesophobia. /r/n/r/n coping with an unwanted phobia such as obesophobia can be challenging. It's important to know that you're not alone. /r/n/r/n in combination with the traditional treatment options mentioned, many people find relief by joining a support group. This can help you meet with others who are experiencing similar challenges and share ways to cope. /r/n/r/n additionally, people who practice meditation and/or journal may find a reduction in anxiety associated with obesophobia. /r/n/r/n fear of gaining weight is also known as obesophobia or pochrosyophobia. It's a specific phobia that causes an irrational and constant fear of gaining weight. /r/n/r/n if you think you have obesophobia, consider talking with your primary care doctor. They can refer you to a therapist or mental health care provider who can develop a customized treatment plan for you. /r/n/r/n treatment for obesophobia includes CBT, medications, and exposure therapy. Many people also find it beneficial to join a support group to improve coping skills or meditate for anxiety relief. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.